Hi class, it's Judy Winzig back again. I'm going to be doing rheumatologic disorders with you. There's 4 points I want to get across to you before I start the whole lecture for the gentleman that we're going to be doing. Osteoarthritis is one of them, and it's a non-inflammatory degenerative arthritis that causes joint pain and morning stiffness, but the morning stiffness only lasts for like a minute or two. It has no cure but can be managed with exercise and medication. Rheumatoid arthritis is a chronic inflammatory destructive arthritis that causes joint pain, swelling, morning stiffness lasting for more than an hour. Treatment for rheumatoid arthritis should be started within 3 months of the diagnosis. The problem with rheumatoid arthritis is about 20% of the patients do not actually come up positive for the rheumatoid arthritis panel that they do. So unfortunately, people can have rheumatoid arthritis, which is what I deal with all the time, and not be positive for RA. The other one that I'm going to talk about is lupus, SLE. It's chronic, and it can sometimes be life-threatening because it is an autoimmune disease, but most of the time it's manageable. Sometimes it becomes life-threatening. It affects major organs. The other one I want to talk to you about is gout. Gout involves 4 phases: the asymptomatic hyperuremia, acute gouty attacks, intercritical gout, and chronic tophaceous gout. So there's four things of gout that you're going to need to remember. Question, bonus, could be a bonus question. So now, the backstory I want to give you that I'm going to be speaking to the gentleman about is that about 4 years ago he had a problem with drugs, but then he cleaned himself up and he got really close with his family again and things are really good. And then his mom died suddenly in a car accident, and he's trying to get custody of his 16-year-old sister. Problem being is he started going back to using drugs a little bit, so there's been that issue, but he's really working hard with the courts to try and get custody of his sister. Unfortunately, she's just been diagnosed with lupus. So what you're going to see is me explaining to him lupus and what it's going to entitle for him to take care of his sister, and what he's going to need to know for the courts, because the courts want him to take this class to understand what his sister will be going through. So the first thing I'll do is introduce myself. Hi, my name is Judy Winzig, and I'm from the respiratory department, and I'm going to talk to you today about the lupus that your sister's been diagnosed with. I know this is kind of devastating and scary for you. You've been through a lot in the last 6 months, but I want to thank you for stepping up and taking care of your sister. It's a tie that can never be, a bond that can never be broken. So the first thing we're going to talk about is what is lupus. So it's a chronic inflammatory autoimmune disease. Now it affects mostly women, which is, unusual, but usually it's women in their childbearing ages. So she's 16, so yes, she could be, able to have children at this point. So it is, you get exacerbations and then you get what's called remission. So she could go for 2 years and not have a flare-up and then have a flare-up. So the really important thing that you're going to need to learn and understand is to notice when she's starting to have a flare-up, because you may catch it before she catches it. She will have a pain with this. We don't know what causes it. We don't know what causes the flare-up. Sometimes it's hormonal, sometimes it's environmental. We don't know what causes it, but do understand that this is not a disease that she brought on herself. It's not a disease that you caused. It's not a disease that anybody caused. It's just something that she was dealt, and it's something that she's going to have to learn to live with. She can live a relatively healthy, happy life with this disease. We never know what it's gonna bring, but then you never know what life's gonna bring. So the couple of things is she could have a rash with this. She might never get a rash. She might have a rash. She also could get oral ulcers. So that's something that if she's gonna have a flare-up, you'll notice she'll start getting ulcers and she'll start complaining that her mouth hurts. So you'll know that possibly that she's getting an ulcer. This can also go into arthritis. It can cause arthritis. That is another, because arthritis is an autoimmune disease just like lupus is. It can cause the same things. Sometimes she can get a renal disorder. Sometimes it'll affect her kidneys. Sometimes she will never get a kidney thing. I just want you to understand that it can affect other organs of her body, but to me, you just take that one day at a time. If something happens, and you'll deal with it. Everybody explain to you what's going to happen, why it's going to happen. But the most important thing for you to do as her brother is love her, be there for her, and just manage the cause and everything step by step as you can do it. So the other thing I want you to understand in this is that this is a disease without a cure. There is no cure. There is no stuff that she can do, meds she can take, chemotherapy she can do to cure it. There's never a cure. She will live with this the rest of her life unless medicine comes up with a cure. And as of right now, there's not a cure. The treatment is to manage the symptoms and then to manage the flare-ups when they happen. The medication, such as Tylenol, Motrin, they'll give those for her to take, to help with the pain. Also steroids. Steroids will become her best friend because steroids will really help with the flare-up and the swelling that happens in her joints. High-dose prednisones is usually used just to treat severely, compromised people. But everybody's different. She will also probably go on something that's called methotrexate, which is really a chemotherapy medication, but by fault they found out that it works really, really well with people with lupus, and it really keeps it under control. A lot of people manage with lupus all the time, and you don't even know they have lupus. It's just when, you'll see some celebrity who get lupus and they'll get really sick and they'll put it on the news. It'll be this humongous thing and really blows it all out of proportion. The other thing is the methotrexate they give her. That will help with her not having so many flare-ups, and when she does have a flare-up, it will make it a lot less, is what they're finding now. Also, these are the doctors that I want you to make sure she gets referrals to from her pediatrician. She's going to need to see a rheumatologist. She's going to need to see an ophthalmologist, a dermatologist, a nephrologist. Well, actually, those three are the first ones she's going to need to see, right? I want you to get in to see. The other ones, any other specialist she needs to see, will decide as things progress or not progress. If they don't progress, there's no reason for you to go see another doctor. But the other thing that I need you to do as a teenager, they're really, really bad. I was a teenage girl. We used to put baby oil on us and lemon in our hair and bake ourselves in the sun. Please do not let her do this. This is really, really bad for somebody with lupus. She's going to have to become really fanatical about using sunblock all the time. So that's probably one thing you're going to have to sound like her dad and harp about making sure she puts sunblock on. That's very important for somebody with lupus, to make sure that they do not get overexposure to the sun. The lifestyle changes that you're going to have to make, you really don't have to do a lot of lifestyle changes. Of course, the healthier you eat, the more you exercise, the more you try to stay on a regular schedule, works better. But that works better in everyday life. So when things start to stress you out, you don't always reach for the right things, you don't always handle it the right way. So make sure that you handle it the way you should. Exercise, eat right. Be very, very open with each other. The more open you are about what's happening, the better off it is for her. Always listen to what she's saying. The best thing you do is for you guys to do a healthy lifestyle, meaning you guys work out together, you guys walk every evening, you guys take turns making dinner. I know this is a huge adjustment for you. You just lost your mom, now your sister's sick, you're only 24 years old. But what you will get back from this experience with your sister is more than you can ever imagine. And then when you become a dad, you can go back and say, I've done this, I got this. This is something that we can do. So just remember to always listen when she starts feeling sick, not feeling good, when she tells you she's extremely tired. Watch her. If she's tired for more than a couple days, take her to the doctors. Even if she argues with you, just make sure you stay on top of everything, because if you stay on top of it, then the small issues will not become a big issue with this disease. I want you to understand this disease is very manageable. Yeah, it's not a cure. It's something she will live with. It's no different than people that are diabetics that have to monitor their blood sugar, or people that are epileptics and have to take seizure medication all the time. It's something that can be done, and it's something that's very, very manageable. So just remember, it's an autoimmune disease. So if people ask you, this is an autoimmune disease. This is nothing that she did to herself. Nobody caused this. It's not anything you did. So now, I think I covered everything that you need to know, but if you have any other questions or you don't understand something, please don't hesitate to ask me. I gave you my phone number. Please call me if you have any questions, if you have any issues. If there's a problem with her, I will be more than happy to help you. Now, class, the other thing that I want to go over now that I'm done with my thing with Tim, the other thing that I want you to understand is, so I told you that there's no cure for lupus. There's also no cure for rheumatoid arthritis. It's an autoimmune disease. It affects your joints. and you are in a lot of pain. That's what people don't seem to get with rheumatoid arthritis. And when you have flare-ups, you can actually end up in bed. The pain is so bad. You will be treated a lot like lupus with methotrexate drug. They will give you that to help with RA. They will give you steroids. They will give you anti-inflammatories. They will try just about everything they can to try your diet, your exercise, everything along those lines is the best way to fight rheumatoid arthritis. And when the flare-up happens, stay on top of it, get your steroids in you, and get moving quicker. Osteoarthritis, unfortunately, there's not a lot they can do for that except for medication. They don't like to give you pain medication, and I always laugh because they don't live in your body. So just be proactive with your health with osteoarthritis. There's not a lot they can do for it. It affects the joints, of course. Sometimes it takes you a little while to get going in the morning, so that's your biggest thing with osteoarthritis. Gout, we all know gout. Gout affects the big toe, right? That's usually the main symptom with gout. And gout is from crystals that land in your soft joints or soft tissue. It usually happens in men that are older than 40. It usually happens to men more than women. It's a sudden onset of joint pain with swelling. It usually occurs at night. Patients can't even stand socks on or a sheet on them. Actually, the definitive diagnosis of a gout can only be made with an aspiration of the joint seminal fluid. And they have to see if there's crystals in it. That's the #1 thing. But usually they do a uric acid level. If your uric acid level is high, then that usually tells you that it's gout, and that's how they go about doing it. But just realize that all of these rheumatoid disorders all kind of go hand in hand with each other. It's just osteoarthritis is the most mild form, and a lot of people have that. If you have any questions, please feel free to call me. Thank you. Have a good day.